Dr. Michele Andrasik and Councilmember Lisa Herbold, who is currently wrapping up another meeting, but will be joining us very shortly. Following our speakers today, we will have a brief Q&A. As a note, please do try and restrict your questions in the first half of the Q&A to vaccine and vaccine-related questions. Afterwards, time permitted, we will circle back because there are certainly other things to ask questions about today. And with that, I'm going to hand it right over to Mayor Jenny Durkan.
Thank you very much, Anthony, and thank you everyone for being here. Thanks for joining us for our first press conference for the new year. And it has already been a remarkable news-filled year with the unprecedented events in our nation's capital last week, together with still just the raging disease of COVID. It is really a pleasure to be here to talk about some good news. We know that Seattle's road to recovery starts with vaccinations. And over the past few weeks, vaccinations have started in the city of Seattle. In order to get back to some kind of normal life, we have to have vaccinations to open our economy, to be able to get together with friends, to do all the things that we've been prevented the last year. And there's no denying that 2020 was just an incredibly difficult year. We were first in the chute for the COVID-19 and then with the economic devastation that followed. We had the uprising and civil reckonings related to George Floyd's death and the systemic racism in policing and other government institutions. Our collective response to COVID-19 in the city of Seattle has saved hundreds, if not thousands, of lives. But still, too many people have gotten sick, too many people have lost their job. And we know that to bend the curve truly, to get to a place where we can get back to some semblance of normality, we have to get vaccinated as quickly as possible. We have to get those shots out of refrigerators and into people's arms. Across the country and in Washington state, so many people have lost their jobs. So many people have lost their businesses. In Seattle, over 600 businesses have closed their door for good, each of those representing dreams of the people who started those businesses and the employment and livelihoods for the people who worked in those businesses. More than 375,000 people have lost their lives in our country to COVID-19. 375,000 people. And the burden of this pandemic has fallen disproportionately on our communities of color, our Black community, our Indigenous community, our Latina community, and others. And it's not just the health consequences, but the economic consequences as well. And we've seen that this COVID-19 pandemic has laid bare the disproportion and inequalities that exist in all of our systems. We have all suffered. You know, we haven't been able to get together with family or hug our loved ones. If your parents, your kids you're homeschooling, your job has been different if you're fortunate enough to have a job. Everything about our lives have changed in the last year. And during this time, and particularly I want to take a note of the mental health consequences of this that exist throughout Seattle, throughout our state. The isolation, the devastation of lives has really led to another crisis of the mental health crisis. Among all these difficulties, it is 2021 will be better than 20 because hope is on the horizon. We have a vaccination, but for that vaccination to give us true hope and not just the glimmer of hope, we've got to get vaccinations into people's arms. We know we need to do this. We've been working with the county, public health, and the state over the last months to see how the city of Seattle could step up and help on the vaccination process because it has to be an all hands on deck effort. I'm very excited to announce today that the State Department of Health has approved the city of Seattle to be a COVID-19 vaccine distributor. This was a step that was necessary for us to be able to set up our own systems for vaccinating people. And the Seattle Fire Department will immediately launch, building off its absolutely incredible testing programs, will launch 2 mobile vaccination teams. We will start getting our vaccine and start distributing it as soon as Thursday of this week. Seattle Fire will first vaccinate residents and workers of adult family homes and will focus on providers who are not being served by the federal programs through the 2 pharmacies, CVS and Walgreens. We really are going to direct our efforts to those people who cannot get the vaccinations in other ways. We have to close gaps, and we have to think about this differently. With enough supply in our 2 mobile teams, we think that in 2 weeks' time, we can provide every adult family home in Seattle not served by the federal government with a COVID-19 vaccination. And with enough supply by the end of February, we will have administered both doses to nearly 1,000 vulnerable healthcare workers, older adults, and people with disabilities in these adult family homes. It's going to be a remarkable undertaking. Chief Scoggins, who will follow me, will give you some more information about that. And in the time between that first dose and that second dose, we plan to extend our mobile teams to partner with organizations and providers who serve older adults, those who are at most risk of death, who may be unable to get the vaccine through traditional healthcare systems. We continue to explore the possibility of launching our own mass vaccination sites, similar to what we've done on the mass testing sites, as vaccines become more widely available. Supply is going to drive everything, but we know right now that we have a certain amount of supply at the state, and we have to be a full partner in helping get those vaccinations into the arms of the people that need them most. We need to vaccinate in order to get to the place of normalcy. Everyone said, well, when are we going to be done? When will we be finished with this? You know, unfortunately, it is an undertaking that our country has never done before, not on this scale, and our state hasn't either. We need at least 70% of the US population or local populations to have some kind of immunity before we can return to a sense of normalcy. That means in King County, about 1.26 million adults, so 1.3 million adults, let's call it, need to have some kind of immunity. You only get it one of 2 ways. You either get sick and recover, or you get vaccinated. So we expect that we have to give about 1.3 million people vaccinations in King County. And that's us together, the state, the county, our healthcare providers and partners in the city. That's 3 million doses almost. That kind of undertaking's never been done before, which is why the city of Seattle is so happy to partner with King County Public Health, the state, our other healthcare providers around the county. It has to be an all hands on deck effort. We need everyone from government to healthcare systems to philanthropy to business to everyday Seattleites committed to getting these vaccinations. We've got to get to that critical mass point. Each of us has a tool at our disposal to help communities get vaccinated. That means if you've got a family member who's eligible but is reluctant, give them the support they need to get vaccinated. Or have that compassionate conversation with someone who may not trust vaccinations or too scared or doesn't want to go to the doctor or doesn't have access to a doctor. We need to make sure that we have factual information and the people who are most vulnerable get access to this vaccine. Because until we reach those immunity levels, we cannot let up on our public health efforts. I want to say that again. I know people are exhausted and depleted. 2020 was so hard at every level, and you saw people kind of give up and relax. I've been talking to the mayor in Los Angeles. They think the number one driver to the COVID crisis they have right now, where all of their hospitals are in danger of being overrun, is that people just got tired of taking all the steps they needed to take in small gatherings and group gatherings and the like. So you still have to wear your mask. You still cannot gather with people and wash your hands and keep your physical distance. It is very hard, but if we want to get out of this, if we want to come together as a community again, really vaccinations are going to be the key. They give us the hope we need, but it's going to be a monumental undertaking. I want to thank the Fred Hutch and others. We have really a remarkable network of people in this city, from healthcare providers to scientists to philanthropists, who have dove in to really solve this issue and bring us together. You'll hear from Michele from the Fred Hutch, who's just been a leading voice on this, on how we get equity in vaccinations and the science behind it. So thankful to have the Fred Hutch as a partner throughout this. You'll be hearing from our fire department. I can't say enough about Chief Scoggins and his leadership, and Brian Wallace, who was here if we need him for answering questions. we started the process of testing for our city facilities because we saw that the systems in place just did not have the capacity to do what was needed to be done. And so we stood up our own testing systems, and they have been remarkably successful. They are one of the reasons why Seattle still has one of the lowest incidents of COVID and hospitalizations of any major city in America. Now we want to be able to do our part in vaccinations too. I'm going to turn it over to Chief Scoggins, who will give some remarks, and we'll keep going. We'll take questions and answers at the end. Thank you all.
Well, good afternoon. And Mayor, I want to start off by thanking you for your leadership and your ongoing support. None of this would be possible without your guidance and leadership. And Councilmember Herbold, thank you and all the members of the council for your ongoing support. And our incredible team led by Dr. Sayer, our medical director, who's been at the tip of the spear on this with Acting Captain Brian Wallace and Sarah Smith and our entire team. There's just many layers of making all this go. You know, the mayor spoke to the testing, and that's been really important for us. And it's important to note that as of January 9th, we had tested over 556,000 people here in the city of Seattle at our 4 testing sites. And our contact team had contacted personally over 20,000 people. So really significant accomplishments. So on January 9th, the Seattle Fire Department received approval from the Washington State Department of Health to allow the department's firefighter EMTs and firefighter paramedics to begin administering the vaccine. Seattle Fire is the first EMS agency in the state that has been approved to be a vaccine administrator. We have transitioned our core work before for our community COVID-19 testing sites and are really looking forward to serving our community in this new capacity. As a fire department, we are truly here to serve. We know we must step up to help when it's needed the most, and now is one of those times. The department will follow public health guidance for delivering vaccinations and will first focus on serving those identified in Group 1A. The first allocation will help fill gaps in some of the long-term care facilities that have not yet received their vaccination through the federal program. The city has identified approximately 100 adult family homes whose residents and staff meet the qualifications for receiving the vaccine. That's where we will first focus our efforts. The adult family homes, which are congregate living facilities, each have an average of 8 to 10 residents and staff. We will vaccinate both residents and staff members at these homes. To kickstart our efforts, we have developed a pilot program called Mobile Vaccination Teams, which will deploy to these facilities to provide the first dose of the vaccination. The program is modeled after our previous Mobile Assessment Teams program, where firefighter EMTs and paramedics deploy to long-term care facilities to conduct COVID-19 testing on residents and staff. Each mobile vaccination team is staffed with 1 firefighter EMT or firefighter paramedic and 2 civilian registration techs. The EMT or paramedic will give the shot, while the registration techs will verify identity and collect information for the state vaccine tracking system. At this time, we think we'll be able to vaccinate upwards of 100 people per day with 2 mobile vaccination teams operating in the city. The teams expect to be able to visit approximately 10 facilities per day. The vaccinations will ideally occur in an outdoor environment underneath a tent or a covered area. The second dose of the vaccination will also be scheduled at the time the first dose is given. For the Moderna vaccine, for example, that's 28 days later. The city is following the same model for community testing sites, where insurance or Medicare will be billed for the cost of giving the shot. The vaccine itself is supplied at no charge by the federal government. If you are uninsured, the UW will bill the Health Resources and Service Administration's grant for the cost of the shot. We are working with our partners at UW Medicine, Public Health Seattle-King County, and Washington Department of Health to get as much vaccine as we can for this pilot until we have a regular supply. Based on a vaccine supply, we expect to vaccinate every adult family home in Seattle not served by the federal program by January 24th, with a second dose provided at each home by February 21st. At this time, we know the first allocation will be the Moderna vaccine. As long as we receive more supply, we will continue to help fill gaps as we move into the next phase of the vaccinations of phase 1B. We are also looking forward to future partnerships to expand our capacity of vaccine distribution. The program will continue to be evaluated as lessons are learned along the way. As your fire chief, I know how critical vaccinating our community is for getting through this pandemic. I plan to get vaccinated as soon as I am eligible, and I hope each of you will do the same. Until then, I'll continue to wear my mask and wash my hands and make sure I maintain physical distance. We can all save lives together. We can end this. Next, I'd like to introduce you to Dr. Andrasik. Doctor?
Thank you so much, Mr. Scoggins. Really appreciate it. And thank you, Mayor Durkan, for inviting me to this important panel. My name is Michele Andrasik, and I am leading the community engagement and social and behavioral science efforts of the COVID-19 Prevention Network, which is housed here in Seattle at the Fred Hutchinson Cancer Research Center. And over the past year, we've been working to ensure that communities have the resources they need to make informed decisions about participation in the COVID vaccine clinical trials, to ensure diversity and inclusion across all of the NIH-funded COVID trials. We have also focused on ensuring that questions about the vaccine are answered in a comprehensible and respectful way, and that information is available to address many of the concerns and the uncertainty that individuals have with regard to COVID and COVID vaccines. In our efforts, we have really centered on Black, Indigenous, and people of color communities because of the disproportionate COVID burden that these communities are faced with. And across the US, we see that Latinx, Hispanic, Latino, Latina, Black, African American, Native, Indigenous, Asian, and Pacific Islander communities are incredibly disproportionately burdened by COVID-19. And much of what we see in the data is most likely underrepresenting the extent of those disparities, because many of the cases and the hospitalizations that we see do not have race and ethnicity data. We know that it's incredibly important that individuals understand that we have longstanding social and economic inequities that have led to our current disparities. We know that Black, Indigenous, and people of color are much more likely to be exposed to COVID because they are in occupational situations where they don't have the privilege to work from home. Many individuals live in multi-generational households, which place our elders at greater risk of exposure because of individuals in and out of the homes. And we also know that stress and pre-existing conditions can exacerbate COVID disease, resulting in severe disease, hospitalization, and even death. So it is incredibly important that any vaccine efforts are equitable and distributed throughout Black, Indigenous, and people of color communities. And we now have an incredibly important tool to reduce the impact of COVID in our communities, and that is the vaccine. But the vaccine itself will not have any impact on these inequities and the disparities that we see in our communities. It really will mean that we take up this tool that is vaccination and ensure that we are getting vaccinated to protect the health and well-being of our communities, our families, and ourselves. And we, over the past year, have really focused on ensuring that all of the trials have included participants that represent the diversity of this country. We've organized expert panelists, which are comprised of individuals who not only represent priority communities, but have spent their careers working with and within these communities. Each of these expert panels has reviewed every single one of the protocols that have gone through the NIH Operation Warp Speed program, and they have provided reports with regard to considerations that need to be taken to ensure inclusion and diversity of BIPOC communities. And I'm really proud to say that the efforts have resulted in a participation across our trials that represent the composition of BIPOC communities in the US. And that is really an incredible statement, because that has largely not been the case across all clinical trials. So if you walk into a pharmacy and you see all of the medications, you can't say that across medications, and we can say that for these vaccines. So now we have these incredible tools at our disposal, and it is really critical if we are going to see any decrease in disparities in hospitalizations and the inequitable burden that BIPOC communities are faced with regard to death. We need to be vaccinated. And it's really important, as everyone else before me has stated, that we continue to wear our masks, practice physical distancing, and avoid large gatherings, because there's still more that we need to find out with the vaccines. You know, and as data become available, we're making sure that we include that in the information that we are disseminating. We're encouraging people to visit our website, preventcovid.org. All of the latest data are available there. Information is made available in English and in Spanish as it becomes available. And there's also a toll-free number there that you can call and talk to someone to get information and have any of your questions answered. So really appreciate being invited to this panel. Happy to answer questions later, and I'll turn it over to Councilmember Lisa Herbold. Thank you.
Thank you so much. No, I'm not muted. Excellent. Thank you. Really appreciate it. New platform here. Thank you for including me in this event today. I just noted in listening particularly to Chief Scoggins, the excitement in his voice. Chief Scoggins is gives a very cool delivery, but I could hear underneath a lot of excitement, and there's good reason for that excitement. This is really an important step in rapidly vaccinating vulnerable Seattle residents, specifically and especially in the continued absence of federal leadership. Thank you so much to Mayor Durkan, and thank you to the city family, as well as the medical community, in showing true leadership in the fight against the coronavirus right from the start. Early on, again, under the leadership of Chief Scoggins, we stood up city-run COVID testing sites. First, we started these sites for testing first responders. I remember at some point I requested expansion from testing just first responders, but to include also human services workers, which the chief readily agreed to that expansion to that population of folks. And then after that, the wisdom under the chief's leadership, again, was to expand testing to the general public, because the need was so clear, particularly for vulnerable populations of the elderly, as well as our Black, Indigenous, and people of color communities, where we saw disproportionate rates of infection. And I really, really want to, from the bottom of my heart, thank the chief and everybody else involved for the vision to expand the city testing to the general public. because now we can use this human infrastructure that we've created through testing, as well as new creativity and additional dedication to move from testing to delivering vaccines beginning this Wednesday. Again, I know it's been said, but I love saying this number. The city of Seattle has provided more than 556,000 free tests for Seattle residents, thanks to the extraordinary efforts of not only Seattle Fire, but from coordination with the Office of Immigrant and Refugee Affairs, Public Health, Seattle King County, the Finance and Administrative Services, and the Seattle Police Department. This week, we finalized a proclamation signed by all members and the mayor to declare January 11th a day that we recognize the unprecedented and unwavering efforts, again, creativity and commitment and dedication demonstrated by all of those who have been working together and have surely saved countless lives in our community that would have otherwise been lost this year during the pandemic. This new effort to speed vaccinations will also save lives, not just those who receive the vaccination and directly benefit from its protections, but also keeping safe our healthcare workers and those whose lives depend on available hospital beds. Our vaccination program will seek to undo the disparity of infections that we have seen in Black, Indigenous, and people of color communities in providing long-term protection for all of those being vaccinated. I want to also thank King County Executive Dow Constantine, King County Council Chair Claudia Balducci, and County Council members Rod Dembowski and Jean Colwells, who announced $7 million to create high-volume community vaccination sites and mobile teams so that as many residents as possible will be quickly, effectively, efficiently, and equitably vaccinated. It's imperative that we tackle this issue as a region. We cannot act alone. Again, we know that vaccination is not a cure-all. We will need to remain vigilant in wearing masks and social distancing, but we know that we can do this because Seattle has among the lowest rates of coronavirus in the nation. With this new vaccination rollout, Seattle continues to lead the way in fighting coronavirus. And again, thank you so much for allowing me to participate with you in delivering this really, really exciting news. Turn it back to Mayor Durkan. Thank you.
Thank you, Councilmember Herbold. Appreciate that very much. I think now we're going to do question and answer for those who aren't familiar with the format. I'll turn it to Anthony to do it. And I just want to reiterate before we do that, what you see here is just a portion of the people who are responsible for the great success the city of Seattle's had on testing. You know, almost 600,000 tests, 560,000 tests that the city of Seattle has done. We represent almost 20% of the tests statewide. And we did it because we saw the need. We saw the need. We're able to resource the test kits ourselves, got a great partnership with the University of Washington, and get the fire department up and ready to do it. So we're hoping we can have a similar success in helping on vaccinations here. With that, Anthony, I'll turn it back to you to start the question and answer from the press.
Thank you, Mayor. And for today's Q&A, once again, I mentioned this at the top, but if there are questions about vaccinations, please, we are going to put those at the front. If there are questions about anything else that may be happening in the world today, of which there is plenty, please save those questions for after we are finished with our vaccination portion. We will endeavor to get to everybody today. Our first question today will come from Nikki Barron from Converge Media, followed by Patrick Quinn, Como News. Nikki, the floor is yours.
Thank you so much. So my question today is, will we see a prioritization of adult facilities in the South End?
So I'm going to let, so the facilities that we'll be doing through the City of Seattle testing is all the adult family homes, and we're mapping out those that are most vulnerable. I will give it to the chief in terms of what the priority will be. But again, we hope within 2 weeks to get all of those done. I know this because I meet on a weekly basis with King County Executive Dow Constantine and Patty Hayes and Jeff Duchin to talk about what our approach is countywide. there will be an emphasis on getting vaccinations to the communities that are most vulnerable. We know that that is disproportionately the BIPOC communities. And so we have, from testing through vaccination, have been really targeting ways to accomplish that, both through community messengers, working with community, but also we know who the healthcare providers and where those homes, senior homes are. So it will remain a priority. I think you also saw, for example, that the state of Washington, for example, in its first tier of who's eligible in 1B, included anyone who is 50 and older who lives in a multi-generational household. That's because we saw clearly from the data that a lot of our communities of color do live in multi-generational households. They may not reach the senior level of 65 or 70 and older, but because of those and because the occupations that they or other members of their household have, their health indicators have been significantly worse. And so we will make efforts to do that. Chief, do you want to add anything to that?
No, Mayor, I think you covered it. But Acting Captain Wallace may want to add to it. I know our team has spent a great deal of time mapping the locations, but our plan is on getting to all 100 in a pretty short period of time. Captain Wallace, you want to add to that?
I can add to that, Chief. So the short answer to your question, Nikki, is yes. We are prioritizing the adult family homes in the south end of town. We're looking at the data. We're paying attention to everything that the mayor, Dr. Andrasik, and Councilmember Herbold have highlighted about the inequities. So we will begin there.
Thank you very much, Mayor, Chief, and Lieutenant Wallace. Opportunity for follow-up, Nikki.
Yeah, so does this also, does this only cover state licensed facilities, or will it also include non-state licensed facilities like independent living and continuing care?
Hi, Nikki. I think it's going to cover the licensed facilities. That's how we're tracking them to get the 100 facilities that we're starting with.
Great. Thank you very much. And just as a quick note to future questions, if you have a specific person you would like to direct your question to, please go ahead and note that in the question. So our next speaker will be Patrick Quinn, followed by Erica Barnett from Publicola. Patrick, the floor is yours.
I think this question's mainly for the mayor, but so this program, it sounds like is really going to be used to fill in the gaps in vaccinating that maybe DOH hasn't been able to get to yet, starting with adult family homes. Mayor, can you just outline maybe what's next? What populations of people you may focus on next?
Yeah. The city has been very limited in the ability to get vaccination. With the certification we got, we will be able to get a direct allocation, but we really need to have a steady pipeline. It's almost like deja vu all over again. Just in the early days of testing, we saw that we did not have the testing kits or sometimes the reagent or the lab capacity. So we're really going to rely on the federal government to provide a steady source. I joined with a number of mayors that are talking to the Biden administration to make sure that we can try to get a pipeline of supplies of the vaccine to the cities themselves so that we can plan, and more importantly, that our residents can plan. So this is the first step. We hope that if we can get that steady supply, we will stand up mass vaccination sites, sometimes side by side with our testing sites, but using that same model and resources, because we know that we can't get to that 70% of people that have some kind of immunity unless we can do this on a really large scale.
Patrick, follow up.
You mentioned that you'll be dependent on how much vaccine you get from DOH. It sounds like they will be the supplier. Do you fear that you're not going to get enough? That they're limited on how much you can get, and thus that will limit how many people you can actually get the vaccine to? And how do you go around that? Are there efforts to, reach out to UW and get vaccine from them or from other outlets to increase the bandwidth of who you can vaccinate?
You're exactly right that the supply is going to limit what we and what the state and Department of Health and anyone can do in this region. And one thing we're trying to avoid is having any kind of Hunger Games approach like we saw in the early days of COVID, where you had state versus state, city versus city to try to get PPE or testing supplies. Right now, the federal government controls the vaccination. And we're really going to be put pressure on them to both give us the supply of vaccination, but also the funding so that we can do testing at a scale that's needed, and we can make sure that we get to those communities that have been disproportionately impacted. And to do that, we've got to be able to partner with the community-based organizations who are closest to the communities. So we really are going to be relying on that. I like everyone, I'm worried because there is a whole globe right now that is fighting for the same supplies. But I'm pretty hopeful in some preliminary conversations that I and others have had with the Biden administration that they recognize the importance that we need to do that. I'll add one last thing is there's other vaccinations in the pipeline that are close to approval that will give us some additional capacity in addition to Pfizer and Moderna. And I mean us, I mean, you know, the United States. So while it's in short supply now, we also know that the challenge has been getting the shots in people's arms. And that's one reason we're stepping into this gap. We see those adult family homes with those vulnerable populations, and there was no one in the system in place that was there designated to make sure they got the vaccinations that they need. And so we're stepping into that breach first.
Thank you, Mayor. And thank you for the questions, Patrick. Our next question will come from Erica Barnett, Publicola, followed by Anna Boyko-Wyrock from KUOW. Erica, the floor is yours.
Hi, this question's for the mayor. I understand the pacing of the COVID vaccine begins with people in group settings and healthcare facilities. I'm wondering, though, once we get to the point where we're vaccinating people who are elderly or who have underlying conditions, people who are experiencing homelessness are not, necessarily all in one place, particularly unsheltered people. How is the city and what is the city and county going to do to ensure that vulnerable and elderly folks who are also homeless are able to get vaccines in a timely fashion?
It's a great question. And I think that, that is a topic that we've been discussing a lot with the county and the state. As you know, some of those people live in congregate settings, like permanent supportive housing. And so setting up systems to get them vaccinated will be easier than the systems that we have for people who are living unsheltered. And so we're having a lot of discussions about how do we make sure we stand that capability up with public health and with our public health providers. So that phase is in robust planning right now, and let us get back with some more information to you on that. But we're hoping in many of these ways, we're seeing in other cities that the number one thing we do is to make sure that we know where people are, because these are all 2-dose vaccines. And so that is going to be one of the logistics things that's going to be difficult in that population.
Erica, follow up.
Yeah, thanks. 1,000 vaccines by the end of February. That seems, like a slow pace coming from the federal government and the state. Are you frustrated with the pace of delivery at all?
I am. I think every American is. We finally got the vaccine that can provide hope, and we just want to get it in arms as quickly as possible. At the same time, I know that there's never been an undertaking like this. It's one reason the city of Seattle is not just standing up this capability, but we want the capability to do more. I think we have proven with our testing sites that we know what we're doing, we know how to get it done, and we know how to get it done on a large scale. We've also gained the trust of an enormous number of people in the city of Seattle. If you look at the numbers, 560,000 tests administered in a city that has a population of roughly, 700,000 to 800,000 people. And if you take children out of that, it means most adults in the city of Seattle may have gone through one of our testing sites. Now we want to get them to our vaccination sites. So the product is the number one thing we need, and we're going to get the systems in place, and we're going to continue to work with State Department of Health, but the Biden administration to get it.
Thank you, Mayor, and thank you, Erica, for the questions. Our next question will come from Anna Boyko-Wyrock from KUOW, followed by Deborah Horn, Cairo 7. Anna, the floor is yours.
Thanks very much. A question for Chief Scoggins and Brian Wallace. Can you talk more about why the adult family homes are the places that these vaccinations are starting? And in particular, did they reach out to you? Did you reach out to them? How did it come to pass that this specific partnership was formed?
Sure, I'll start. This is Chief Scoggins. As you remember, when we started walking down the road in COVID, the long-term care facilities were a particular concern because of the vulnerable populations inside the facilities. The same mindset still exists today. These facilities that we've identified through Seattle-King County Public Health don't have necessary connections to care providers to provide the vaccine. That's why we're going to start in this location, in these locations.
Anna, follow up.
Muted. Sorry, I was muted. And then, so getting to the mass vaccination sites, how extensive would you all like those places to be? You know, looking forward, if you had the supply, how many locations across Seattle, how many people a day are you shooting for?
Mayor, you're muted.
Anthony, there we go. I'll start with that. We want to have City of Seattle, we've one of the cogs in the wheel. This is going to require an unprecedented amount of mass sites. We want employers involved. Our hospitals have already started to get involved to make sure they get their own healthcare workers. We know that there's a number of places that people go to as a regular, either go to their doctors a checkup or they have another reason to go to a healthcare provider. We're looking for creative places where people will gather to make sure that we can actually then use those as a place to do vaccinations. We're talking to Seattle Public Schools to see if we can use public school facilities to have another route for people to get in. So it really will have to be an all hands on deck approach where everyone's taking part of the population. City of Seattle would like to do as much as we can to cover those places where we know people are not going to get access because they're not a healthcare worker working in a hospital or a teacher working in a school. And we know who those are. They're the communities who are already being disproportionately impacted by this disease and its economic fallout. And that requires us to go in and work with those community health partners, with the community-based organizations, and to get that level of trust so people, really the limiting factor is going to be supplies. If we can get the supplies, then it's math. We have to get to 1.3 million adults in King County. And then we've got to be able to do them again. So that is an enormous undertaking. And is one that's going to require a lot of trust, a lot of outreach, but it's also going to require us to get access to the vaccines.
Thank you, Mayor, and thank you, Anna. Our next question will come from Deborah Horn from Cairo 7, followed by David Croman, Crosscut. Deborah, the floor is yours.
I do want to ask the mayor, Happy New Year to everyone. I do want to ask the mayor a question, and that is, two questions, and I mostly want to talk about another topic. So I want to, when you go back around, I have some other questions I need to ask on another topic as well. Where is Seattle, King County in all of this and the public health? And also, are you considering giving people one dose and then hoping that you get, so that you give out all the doses that you have? Because this has been an issue. Is one dose efficacious enough for people to at least have that, and then work to get the supply ratcheted up so that you can give a second dose? And then I need a question to the fire chief after that.
Thank you, Deborah. And I'll let the fire chief follow up on this, but we've had discussions with that. I talked to Dr. Durkan about that yesterday and have talked to some of the experts on the national level. We're going to follow public health and CDC guidance right now. And that guidance is you do not just give one dose, get another dose. I think it's particularly for those people who are the most vulnerable populations. We know from the studies the efficacy of the vaccine is really most after 2 doses. So right now we will be following the public health guidance, which is to make sure we give 2 doses.
I have nothing to add to that, Mayor.
Deborah, follow up?
Yes. Chief Scoggins, I wanted to ask, you said that you will take the vaccine yourself. When do you have any idea when you might do that?
Well, we have a great team working on it, and whenever they, let me know I can, I'll be in line with the rest of our folks here in the SFD. We're really working hard on getting all of our frontline folks the the opportunity to take the vaccine. These are people that are responding to the 911 calls each and every day, serving community. That's our primary focus. We're trying to really keep them healthy. So when my team, who's really engaged in this process, let myself and the other members of the SFD leadership know, we'll be in line just like everyone else. I'll let you know, Deborah.
Thank you very much, Deborah, and thank you, Chief Scoggins. Our next question will come from David Gutman, Seattle Times, and then we will pivot over to non-vaccination related questions. David, the floor is yours.
Sure. Just want to make sure I'm not cutting David Croman, but I'll go ahead. You mentioned that the city got approval on January 9th to be a vaccine distributor. I'm wondering when the city submitted the application, so how long kind of the approval process took and what was involved in getting approved.
Sure, I'll start. And we submitted that application in late November, and Acting Captain Wallace will cover some of the details. And there were quite a few steps in getting approval.
So David, one of the primary points of the application was being able to prove that we were able to safely store and knew how to handle vaccine. So we had to set up our refrigeration and freezer systems with data loggers, submit that data to DOH, and basically turn over to them a lot of the details of our plan for being able to be a qualified vaccine provider per CDC guidelines.
David, follow up?
No, I'm good. Thank you.
Great, thank you. I see a hand raised from Kayla Lafferty from King 5. Kayla, is this question vaccination related?
Yes, this one's about, so the federal public health officials are now recommending everyone 65 and up be given access to the vaccine. Does this factor at all into what comes next with the city's plan for vaccinations, and in particular with this new mobile unit?
Sure, Kayla, this is Chief Scoggins. I'll start. It could. Right now, our focus is following Seattle King County public health guidance and really working through the adult family homes. But our goal is to be able to expand this in the future. It's like I said earlier, we want to stand in the gap and we want to help community. So if we're given the vaccinations and the guidance and directions, we're more than happy to step into whatever space they put us in.
Kayla, follow up?
I think that's all I have. Thank you.
Okay, thank you very much. And I want to thank everyone for their patience as we still work through these vaccination questions. We also have Allison Grande from Cairo 7. So Allison, go ahead.
This question is for Mayor Durkan or for Chief Scoggins. You talked about success with those mass testing sites. They're still going to need to be having testing in the city. So would you consider using one of our stadiums as a mass vaccination site?
So it's a great question. We've talked about a number of locations we might do, and I think we'll assess at the time. One of the things we've been looking at is how we might convert one of our mass testing sites to be a hybrid site. And we also want to make sure that we can get the vaccinations available to the people who are going to need it the most. And we have to be very careful during this vaccination process that we don't replicate some of the inequities that we've seen before. And so that means, number one, getting to communities so people can trust it, getting to communities where there might not be a relationship with a healthcare provider. And that means making sure that we have that regular communication with and do the extra work we need to do to get to our BIPOC communities. So the location of it really is going to be data-driven as well as facility and capability. As you've heard, we've got to have refrigerators. We've got to have everything stood up so that we can do it safely as well.
Allison, follow up?
Hey there, just to follow up on that, we see the real need in this sense, stepping in for the city, the fire department to go to those adult family homes. Do you see another gap? Can you see what's next on your list? Are you starting to plan for what the next step is going to be?
Chief, you want to tackle that?
Sure. Yeah, we are planning and we're working through the guidance that's being provided to us by Seattle King County Public Health, and they're in alignment with the CDC guidance. So we are planning for those, and it's going to depend on a couple of things. It's going to depend on the amount of vaccine that we can actually get our hands on to start deploying, and the guidance that we're given. And it's like I said earlier, we're ready to go to work and help, and that's what our plan is to do.
Thank you very much, Chief, and thank you everyone for the questions today. At this point, we're going to pivot away from vaccine-related questions. So I want to sincerely thank our Chief, Lieutenant Wallace, and Dr. Andrasik for joining us today, and invite them if they would like to step off the call as we answer further questions.
And I want to thank them for their work. That has been remarkable work, and it's not done yet. So thanks for the future work too.
Thanks, everyone. Thank you, Mayor. Our first question for this portion of the Q&A will go to David Croman, Crosscut. David, thank you for your patience. The floor is yours.
Yeah, hi, Mayor. It seems clear that Mike Solon is neither going to apologize nor resign. I'm curious about what you think next steps should be taken and what this all means for the city's ability to negotiate a new contract with SPOG.
So, David, I thought his comments, as I said at the time, were absolutely indefensible and reflected a perspective that shows not someone that is not willing to come to the table in good faith to really listen to what we need to do on police reforms. Obviously, the union has the right to choose their leadership. We can't dictate that as a city, but they do have an obligation to come to the table in good faith and to bargain those issues that we know need to be changed. My personal opinion is I think that his comments and even the defense of those comments have shown that he is not that person, but that's a choice for SPOGs choosing their leaders. We are going to go to the table. We are going to look for the reforms that we think is important for the Seattle Police Department. And we're hoping to have someone at the table who will be a true partner to negotiate those things in good faith.
David, follow up?
If the city concludes that it's not in good faith, is there anything, could you bring in the NLRB, or is there any steps that can be, taken to remedy that?
Proving that something is not done in good faith is very difficult, as you know. But look, we're going to be looking at all options through the working with the city council, setting the right parameters, and making very clear in the room that some of the things that we think we need to bargain to improve the Seattle Police Department. Again, I think that there's been pretty universal condemnation of what Mike Solon said. And I would have hoped that he, upon reflection, would have realized that he should not be representing his membership with such statements.
Thank you, Mayor, and thank you, David. Our next question will come from Patrick Quinn. Patrick, the floor is yours.
We saw your tweet last night in response to Congresswoman Pramila Jayapal saying that she tested positive for COVID. What's your level of concern as her tweet asserts Republican leadership potentially not following the basic guidelines outlined by the CDC and not wearing masks moving forward?
First, I want to say that I hope she recovers quickly. I think it was when we saw that assault on the chamber and the assault on our Capitol by people determined to set aside a legal and fair election in our democratic process. We saw Pramila Jayapal trapped in that chamber, someone who's had her own medical challenge recently because he had surgery. She should not have to suffer a second affront because her own colleagues won't take the basic precautions that everyone knows you need to take to keep other people safe. It's just inexcusable. It is time for people to quit treating a health crisis like a political issue. It's not. We all have an obligation to help our neighbors, our communities, our friends. And one of the ways you do that is you wear a mask. You keep your physical distance, you wash your hands, you take the precautions you need to take, not just for yourself, but for everyone else around you. So I think that it is unfortunate that people saw that as something that could be a political statement and wave away someone who's trying to give them masks. It is time for that kind of activity to end. We will not beat COVID if people keep treating it like a political issue instead of a public health crisis.
Patrick, follow up?
I'm good, thank you.
Great, thank you. Brief pause here to see if there are any additional questions. If you would like to raise your hand using the hand raise feature, additional questions for the mayor not vaccine related. Okay, Deborah Horn, the floor is yours.
Thank you so very much. Now I'm trying to get back to my original page, but I guess I will have to give up on seeing you as you answer the question, Mayor. But nonetheless, I do have two questions. One of them is about the two officers being investigated by the Office of Police Accountability by the at the request of the police chief, the interim police chief. What is your reaction to that, to the fact that the two officers were seen on social media, and that is how one of their co-workers was able to alert the higher ups? And I do have a follow-up.
So thank you, Deborah. I think that Chief Diaz took the exact right steps. And I also think the officer who saw that on social media took the right steps. As Chief Diaz made clear, it is obviously not against policy to participate in a political rally or First Amendment speech on your free time. But it would be against policy if they were at all involved in the insurrection and assault on the Capitol, which included assaults on other police officers. And so his referral to OPA will be determining whether there was a violation of policy and what their exact role was there. I would also note that I think that it is helpful and it's a good sign that a fellow police officer who saw this on social media, that it raised enough concerns for them that they brought it to their chain of command. Seattle Police Department is starting additional training to really reinforce their rule that if a police officer sees one of their colleagues do something wrong, they have a duty to step in. And so I think this is a good indication, but it's also a reason why the training that the chief talked about yesterday will go forward with the Seattle Police Department. And I just do want to give Chief Diaz credit for taking those steps and making it very clear that we will protect First Amendment speech, but if that First Amendment speech was not that, if it was not First Amendment speech, and instead they were somehow involved in illegal activity, that he will terminate them.
Deborah, follow up?
Yes. A follow-up question, Mayor. Miller Playfield, as you know, and I expect that you do know this, has been a place where all kinds of sports activities involving kids have happened. O'Day High School's lacrosse team plays here. I'm just learning this today. Holy Names, girls soccer plays here as well. And if you've had an opportunity to come by here or have even seen any of our stories, you will see that it does appear that there's a much larger homeless population outside of Miller Playfield than there was when Cal Anderson Park was fully occupied. So I'm assuming that you know this. I'm assuming that if you don't, let me know. But what can the city do? We're about to talk to someone who's trying to gather together a coalition of people. He's saying he's not here to, it's not a NIMBY occasion for him. He wants to find housing for the people here, but this playfield cannot be a place where they live.
Thank you, Deborah, for the question. As you know, that under the CDC guidance, people experiencing homelessness and or living unsheltered, the guidance was not to displace them unless necessary. And we have done very limited numbers of homeless encampment removals. And since the COVID crisis began, each one of those has really had and required up front for us to do a lot of community engagement, to reach out to people, to get them a place inside safely that they can be. Unfortunately, a number of people don't take that offer of services for different reasons. And we have seen now, not just at Miller Playfield, but in parks throughout this city, there has been a growing number of encampments. And so the Parks Department, working with other city departments, is really trying to figure out now what the approach is and which parks first. We are very happy that the City Council did approve additional resources, both for outreach, but most importantly, for additional shelter space, so that we'll have the ability for about 500 additional shelter places. In addition, this year, we will have many, many new units for permanent supportive housing coming online. So we will finally have the capability to have places to bring people and places for people to go. And so not just Miller Playfield, but those, we will be working with our outreach teams to see how we can reach into those encampments, get people the services they need, get them out of the parks and restore the parks to the community.
Thank you, Mayor. And looks like we have one last question, and that will be David Gutman, Seattle Times. Go ahead, David.
Yeah, thank you. The city supported a federal court's ruling in Philadelphia that allowed a nonprofit there to open a safe injection site. That ruling was just overturned by the Third Circuit Court of Appeals. I'm wondering if this new ruling impacts Seattle's plans to put out a contract with public health for safe injection resources at existing social service locations.
So the ruling, I haven't had a chance to read it yet, David, but we were anticipating that might occur. We'd also gotten very strong indications from the federal government that should we try to do anything here, that they would try to shut it down. And so City Council reprogrammed those funds with public health. We're trying to see right now what public health can do, working with public health to see how do we move those dollars to actually help people who have a behavioral health issue, particularly substance abuse disorder, and provide support and treatment for them. And so we don't know exactly what that looks like now, and this is another wrinkle that we're going to have to deal with.
David, follow up?
Nope, thank you very much.
Thank you, David.
Thank you very much. And I believe that will conclude today's press conference. I want to thank you all for joining us here today. Mayor, if you have any closing thoughts, we have a few people still on listening.
The only thing I would say, since we're not talking vaccines right now, is what we saw last Wednesday in Washington, D.C. was absolutely unprecedented. And we as a nation and a city cannot let it become a new normal or an outrage that we forget days later. And the president made very clear today that he has absolutely no remorse for his role in that insurrection. And in fact, when asked and given the chance by the press to do so, he not only excused his actions, but again, blamed Seattle and said that the real problem was Portland and Seattle. It is not normal. We need, and I support our whole delegation who believe that the president needs to step down immediately, and since he will not step down, to be removed from office. And I do not want to hear one word from the Republicans on the Hill that it's time for peace and unity, and that we don't have time for this. The same members of the House and Senate, the Republicans there, who say we don't have time for an impeachment, thought nothing about ramming through a Supreme Court justice before an election. In order for there to be truth and reconciliation, there first has to be truth. And part of truth is accountability. So I support our delegation in their efforts to remove the president. I think we need to move on. We also are working very closely with federal officials and the state to make sure that as the inauguration comes, that we don't see the kinds of armed insurrection and problems here in the city of Seattle that have been threatened throughout the country. Thank you very much. Hope everyone has a better 21 than we did 20. Take care.